If there is one business model every American hates, it's health insurance. Because it doesn't protect the sick, it exploits them. In most developed countries, healthcare costs $0. But in America, every person pays about $14,500 a year just for health insurance. And even after all that, 1 in 12 adults owe medical debt, a staggering $220 billion nationwide. What that really means is you could get seriously sick, pay thousands, and still end up with a massive bill. And it's not random. America's health insurance system is rigged in 3 major ways, starting with the lack of transparency. Imagine walking into a store where nothing has a price tag, where every cashier charges you differently for the exact same item. That's exactly how healthcare works in America. Millions of patients have no idea how much a drug or procedure costs until they're hit with a massive, shocking bill. Pharmacy Benefit Managers, or PBMs, first appeared in the 1980s. The original goal seemed straightforward: act as the middleman to negotiate lower drug prices between manufacturers and insurers. Manufacturers would set a list price. PBMs would negotiate discounts. Patients would pay less. But over time, PBMs evolved into opaque giants that now control over 70% of all prescription drug transactions in the US. They became profit centers for themselves. Rather than passing rebates directly to insurers or patients, PBMs kept the deal secret. This secrecy removes any real incentive to lower drug prices. A 2020 report from the House Oversight Committee revealed a disturbing fact. The rebate system incentivized PBMs to favor higher-priced drugs. Why? Because a higher list price means a larger rebate, more money for the PBM, while the patient pays the same outrageous amount. An independent analyst by the National Bureau of Economic Research confirmed this preserved incentive structure. It showed PBMs actively promoted more expensive medicines in exchange for larger rebates. Meanwhile, a study by Harvard researchers revealed that fewer than 2% of patients receive a price estimate before undergoing a medical procedure. Hospitals, similarly, are notorious for wildly inconsistent pricing. A CT scan in Boston could cost $270 at one facility or over $5,000 at another for the exact same procedure. Why is this allowed? Because hospitals negotiate rates with insurers behind closed doors. These private contracts remain secret, even from regulators and patients. In fact, a 2021 study showed over 60% of hospitals fail to disclose standard procedures prices, despite being legally required by the Affordable Care Act's price transparency rule. Contrast this with Japan, where the government sets a standardized price list for every procedure and drug. Patients know upfront what a surgery will cost. Hospitals can't charge widely different amounts for the same service. Germany follows a similar model. Employers and employees pay into public insurance funds that are tightly regulated. These funds set predictable prices, creating transparency. Germany spends about $6,000 per person per year on healthcare, compared to over $11,000 in the US. The industry defends secrecy by claiming it protects competition, but this argument doesn't hold up. Research shows that when patients have access to clear pricing information, they are more likely to choose lower-cost providers, driving competition and helping reduce overall healthcare costs. Instead, the US structure shields PBMs and insurers from market forces. It prevents patients from comparison shopping and locks them at the mercy of hidden middlemen. This isn't accidental, it's intentional. Years of lobbying by PBMs and insurers have ensured transparency laws are weak, watered down, or ignored. In 2021 alone, the Pharmaceutical Care Management Association, representing PBMs, spent over $15 million lobbying annually. This kind of power guarantees the status quo stays exactly the same: opaque, unaccountable, extremely profitable. The alternative exists. Countries like Germany and Japan prove that they can run a fair, transparent system where prices are known upfront and treatment is based on medical need. But even if the price tags weren't hidden, most Americans don't get to choose their own health insurance. Instead, they're logged into employer-provided plans designed to trap them in high costs, poor coverage, and few real options. Millions of workers assume employer-provided insurance protects them, but in reality, it locks them into rising premiums, high deductibles, and minimum control over their care. This system didn't emerge from innovation, it was born out of wartime policy. During World War II, the federal government imposed strict wage controls to manage inflation. Businesses couldn't compete by offering higher salaries, so they turned to health insurance as a tax-free perk to attract employees. By 1943, the IRS ruled that employer-provided health insurance was not taxable income. That policy was never reversed. Over decades, what started as a workaround became the backbone of American health coverage. Today, over 157 million Americans rely on employer-based insurance. On the surface, surface, it looks like a benefit, but dig deeper and the cracks are obvious. Between 2008 and 2022, average family premiums nearly doubled from $13,000 per year to over $22,000. During the same period, median household income grew by just 15%. Meanwhile, high deductibles became the norm. In 2022, the average deductible for family coverage exceeded $4,000 per person. So even with full coverage, workers still pay thousands out of pocket before insurance kicks in. A 2021 study from the Kaiser Family Foundation found that over 30% of Americans skip care due to cost, despite being insured. Why does this happen? Because the system is structured to protect insurers, not patients. Employers often lack bargaining power. Many small and mid-sized companies are forced to accept plans dictated by a few dominant insurers. In 18 states, just 2 insurance companies control over 80% of the market. Economists call this an oligopoly, a market dominated by a handful of players with little competition. When 2 or 3 insurers control 90% of a state's market, the competition evaporates. They have no incentive to lower premiums or improve coverage because customers have almost no alternatives. Globally, the contrast is stark. In Germany, employees and employers pay roughly 14 to 15% of income into public insurance funds that cover nearly everything: doctor visits, prescriptions, hospital stays. The government sets prices for every procedures and medication, keeping costs transparent and predictable. Japan uses a similar system. Every citizen must enroll into a public or standardized employer-provided plan, with price controls for all medical services. The US system is fundamentally different. Opaque middlemen, limited insurer choices, and secretive negotiations dominate. The industry defends complexity as necessary for efficiency, but studies consistently prove the opposite. Perhaps the cruelest part? The illusion of choice. Employers are told they offer competitive plans. Most are logged into an industry designed to extract maximum profits. The supply chain works like this. Large insurers dominate local markets. Employers have almost no leverage. PBMs complicate the drug supply chain, hiding true costs. And the ultimate victims? Workers and families who believe they're covered, until they're hit with astronomical bills when they need care most. A system where risk is pooled publicly, prices are regulated, and benefits are standardized could eliminate these traps. Countries like Germany and Japan prove that fair, affordable coverage is possible. But even with fair pricing and employer traps removed, another problem remains, one that hits patients directly at the point of care: outright denial of treatment by insurers. Having health insurance doesn't mean you're actually protected. It's a brutal truth few Americans are willing to confront. In 2021, the Kaiser Family Foundation revealed a startling statistic. 1 in 5 medical claims is initially denied. It's a deliberate strategy built into the system to maximize profit margins for insurers. Insurance companies are legally required to spend a certain percentage of premiums on actual Medicare, typically 80 to 85% depending on the state. But by denying or delaying claims, they manipulate accounting categories to skirt this requirement. For example, classifying a claim as under review or investigative prevents it from counting toward the medical loss ratio, letting insurers retain more profit. A 2021 whistleblower report revealed internal memos at a major insurer outlining monthly denial quotas to meet profit targets. Executives openly instructed claims adjusters to be aggressive with denials, fully aware that many patients would lack the time, knowledge, or energy to appeal. Even when patients do appeal, the process is painfully slow. Contrast this with other countries. Canada, single-payer system with standardized approval criteria. Claims are rarely denied, and patients understand the reasoning when they are. Germany, treatment approvals are regulated. Doctors prescribe based on medical need, not insurer permission. Why does the US differ so drastically? Lobbying is a major factor. The American health insurance plans, representing major insurers, spends over $100 million annually shaping policy in their favor. Even landmark legislation like Affordable Care Act in 2010 left loopholes untouched. Today, no federal law requires insurers to fully explain why a claim is denied. Patients often receive a vague reason, not medically necessary, experimental treatment. The human cost is immense. Patients skip treatments, illnesses worsen, medical debt skyrocket. This is a system where access to care isn't a right, it's a privilege. It's determined by paperwork, quotas, and profit incentives rather than medical need. Countries with regulated approvals and universal coverage show that care can be guaranteed based on medical necessity, not profit. The US system isn't broken by accident. It's intentionally structured to maximize profits at the expense of patients through opaque pricing, employer traps, and denied care. The question now isn't whether change is needed, it's whether Americans will demand a system where healthcare is a right, not a privilege.